Hello, everyone. Thank you for joining our webinar about COVID vaccines tonight. My name is Lauren Aragoni, and I'm the nurse moderator for tonight's event. I've been a pediatric nurse for 11 years, and currently I'm the nurse practitioner for the COVID outcome study at Children's National. Please place any questions you would like the vaccine experts to answer in the Q&A box in the Zoom toolbar. And at the end, after they speak, we'll definitely be able to answer some of your questions tonight. This is also being recorded and will be posted to YouTube, so feel free to share the event with your family and friends that also might be interested in this information. And we have a brief 1 to 2 minute survey that will help us understand how parents feel about the COVID vaccine. It's completely optional, voluntary, and confidential. A $50 gift card will be raffled off, and feel free to scan the QR code using your phone camera, or you can type in your web browser redcap.link/COVID1234. COVID needs to be capitalized. It is case sensitive, and I'll also put the link in the chat box as well. So if you could just take a brief one or 2 minutes to fill out that survey, that would be wonderful. The survey will also be taken at the beginning and the end of the webinar as well. So I'll just give everyone a few moments to go ahead and do that. Place that link in the chat box. Our first speaker tonight is Dr. Bernhard Wiederman. Dr. Wiederman specializes in the care of children with pediatric infectious diseases of all types, with a special emphasis in children with transplanted organs. He is a graduate of Rice University and completed medical school, pediatric residency, pediatric chief residency, and pediatric infectious disease fellowship at Baylor College of Medicine. Currently at Children's National, he oversees a research trial of the Pfizer COVID-19 vaccine for children ages 6 months through 11 years. All right, Dr. Wiederman.
Well, good evening, everybody, and thanks for attending. And I'm very pleased to be here. I'm only going to have one slide, and this is it. I'll address it, but overall, I want to try to give all of you just an overview of what it's like to be in a COVID vaccine research trial. So I do want to cover the material on this slide that has caused a lot of confusion, I think, and misinformation. So we'll go over that, and then after that, I'll tell you a little bit about what parents who have their children participating in our trial, what they're experiencing, and then some results of the trial and where things are now. So first of all, you probably know that 2 of the vaccines authorized for use in the United States are so-called messenger RNA vaccines, or mRNA. That's the Pfizer and Moderna vaccines, as they are known. And I just wanted to explain things a little bit because there's so much misinformation out there. I'm not going to make everybody a biology scholar in 2 minutes, but just so you know, messenger RNA is sort of what it sounds like. It is genetic material in all of our cells, but it acts as a messenger and tells the cells how to make proteins. The technology and the study of an mRNA vaccine has been going since the 1990s. The vaccines that we're talking about now for COVID-19 has pieces of messenger RNA that are wrapped in a protective coating um, to enable it to be delivered to our bodies. If we just injected the mRNA without the coating, it wouldn't be able to do its job. But it's important to note that the vaccines do not contain any virus. You can't get COVID-19 from the vaccine. And also this messenger RNA, although it's a type of genetic material, it can't change our DNA in any way. But what the messenger RNA does is teaches some of our cells how to make copies of this spike protein of the COVID-19 virus. And after it does this, it and all the components of the vaccine are quickly eliminated from our bodies. And by quickly, I mean in the order of hours. But although all that's gone, this spike protein then sort of teaches our immune systems to make antibodies and other immune cells that can deal with that protein if it sees it again, and in particular, if it sees the SARS-CoV-2 virus in the future, it enables our bodies to fight it off before it can produce harm. So that's sort of the basics of the mRNA vaccines, but let me tell, and I'll leave this slide up there, but let me tell you sort of what's involved in participating in a vaccine research trial, because it's very different from when we went to get our vaccines and got it pretty quickly, and we were observed 20 minutes and went home. With a research protocol, we don't undertake this lightly. Parents are enrolling their children, mostly healthy, stable children, and paramount for all of this is their safety. So a lot has to be done for safety. And for any research at all, I and any other investigators have to go through hours, days of training in research practices, just generally. And in fact, we have to be retrained and recertified every so often. So there's quite a lot of hurdles before people can do this type of research. And a lot of that is ensuring, as I say, safety, but also that parents and children who are old enough to understand know what the trial, what will happen with the trial, and know their rights and have the opportunity to ask questions. And that's all very important to do. The other thing about this trial and many trials is that neither I nor the children nor the parents initially know whether they're receiving the real vaccine or a placebo that doesn't do anything to our immunity for COVID. And that's very important. It's called a double-blind study, but that ensures a lot of quality of the data. And I can go into that more if you like at the end in the question session. But know that families enter into this knowing their children may not get the vaccine, at least not initially. And then the families, if they do agree to be in the trial, they have to commit to a lot. So the visits for the injections take about 2 hours. So it's not like showing up at a vaccine center and getting a dose of the vaccine. They agree to record symptoms in electronic diaries after each of the shots. They agree to notify me to do diary entries once a week to notify me if their child has any kind of illness. And this study actually lasts about 2 years in all, because we're following up on those children and seeing how they do and if they get sick and things like that. So we're really, these families are absolute heroes. They've agreed to a lot of work with that. And then as far as the results of the trials, I think you're all aware that the Pfizer vaccine was authorized for use in the 2-dose regimen for children 5 through 11 years of age. That was based on the data from our trial, which of course is going on at many centers around the world, not just at Children's National. And there are ongoing things, as you know. The trials for the younger children didn't have to be as large as they were for the teenagers and adults. That's common in vaccine research. So we were looking to see if the antibodies produced by the children were comparable to what was seen in young adults. That particular outcome endpoint wasn't seen, as you may have heard, in the children who were in the 2 through 4 years of age, was seen in the younger groups. So that part of the trial is still ongoing. And now we're looking at 3rd doses or booster doses in all the children. And we hope we'll see some results of that in the coming month or so. But with that, I'll stop and turn it over to my colleagues. And thank you for your attention.
Great. Thank you so much. Thank you so much, Dr. Wiederman. Our next speaker tonight is Dr. Alexandra Brugler-Jans. Dr. Jans is an attending physician in infectious diseases at Children's National and is an assistant professor of pediatrics at the George Washington University School of Medicine and Health Sciences. Dr. Jans completed her pediatric residency and was a chief resident at the University of California, Davis, and completed her pediatric infectious disease fellowship here in DC as part of the combined Children's National U.S. Food and Drug Administration Program, or the FDA. Dr. Jans?
Thanks, Lauren, and thanks, Bud, for that great overview on clinical trials. So I am going to talk a little bit about COVID-19 vaccine hesitancy, a little bit about the scope of the problem, kind of why we're having this problem, what issues add to parents not wanting to vaccinate their children, in particular with this vaccine, and what can be done about it. And in particular, what you all as parents or peers can do to interact with your friends, with your peers to combat vaccine hesitancy. So to touch on the scope of the problem, upon recent CDC data, about 26% of eligible children, and so this is any child from age 5 to 11, have been vaccinated fully at this time. And that's for a vaccine that we've had available since November. It's a little bit better for older children. For adolescents 12 to 17 years of age, about 58% of those are fully vaccinated, but still lagging way behind the numbers we have in adults. And this is an issue for multiple reasons. Not only are we not protecting these individual children, the 75% of those that are unimmunized against infection, but the less protection there is, the more risk there is for community transmission, and the more risk there is for mutation of the virus and variants as it's continuing to spread in the community. And the graph to the right, or figure to the right, just demonstrates the differences, or I guess the changes in cases of COVID-19 overlaid with vaccinations in that same age group. So the top left box, which is the 5 to 11-year-old children, you'll see that in the blue shaded area, that represents those number that are infected or percent of persons that are fully vaccinated. And then the gray shaded area represents new cases per 100,000 population. So, this likely where the peak starts would be about November 2021 when the vaccine was authorized for 5 to 11-year-olds. So you can see the cases far outpace the vaccinations. You can look at other trends, sort of when the vaccines were approved, and there's less of a stark difference. And in particular, the adults who've been approved for a much longer time, there's far higher rates of vaccination than there are new infections. So it really does make a difference in terms of the population. Let's see. Next slide. So kind of how do we characterize this? We know that there is not 100% uptake of vaccines at this point. But there have been some surveys done by particular organizations, and in particular the Kaiser Family Foundation, which does a lot of medical and health surveying of the population. And they identified that there's different subsets of the population that are more or less likely to want to vaccinate their children. And from that and other papers published on this type of subject, there's sort of 3 different categories. And this actually pertains to hesitancy about other vaccines. So some of this comes from the literature predating COVID, because there has always been hesitancy in vaccines. And there's sort of 3 groups of people that we think about that maybe aren't as excited about vaccines. So the first group is what I call the unworried. So those may be parents that don't necessarily see a need for vaccination. And to call your attention to the figure on the left, this falls into that bottom bar. You'll see parent COVID-19 vaccination status. And the questions that they ask based on different colors are, how worried are you that your child will get sick from the coronavirus? So you can see in the groups with more green, indicating less concern about their child getting sick, there's a much higher proportion of those parents that are also unvaccinated, so also consider less concerned about getting sick. So that is a major category, but we'll talk a little bit more on the next slides about how to kind of address that, how to talk to these folks about their concerns. And this can be one area where things like incentives and trade-offs can work out. So giving them, if they don't perceive the disease to be a risk, what can make it worth their while with the vaccine? Is there something else? Is it a donut, as Krispy Kreme did? Is it free beer? Or is it just protecting your neighbor's immunocompromised child? So looking for other ways to appeal to the need for vaccine beyond their personal health. The second group that's sort of been identified is the skeptical. So these are the individuals that have concerns about something about the vaccine itself. So whether it's safe, whether it works. These may be the folks that fall into the wait and see category, who are the ones that jumped right out to the vaccine the first day it was approved, rather wanted to wait for some other findings, some other news down the road. And that is a lot of folks, particularly with the COVID-19 vaccine. Safety issues, concerns about side effects have been one of the most prominent concerns identified through some of these types of surveys. And appropriately so. You should be always asking questions about what you're giving your children. That is appropriate. But you want to make sure that you're talking to the right source and with the right information. And I'll touch on that. And then the third group is maybe the most challenging. This is the ideological group. And these, I won't spend much time talking about these. Research has shown that this group of people are the least likely to want to engage in any conversation, to have any questions, to have any potential for changing their mind, often because of political reasons, religious reasons, or other things that they define themselves by. One other aspect of vaccine hesitancy that I wanted to bring up is that lack of vaccination is not truly always hesitancy. Sometimes it is a lack of access or a lack of opportunity, which is another area that can be addressed by friends, by peers, by medical professionals, and overcome that hump pretty easily, actually. So, but not making assumptions about why someone's unvaccinated is key. Next slide. All right. I think we can skip this slide, actually. All right. So what can you do as a peer, as a parent, to help with issues of vaccine hesitancy? Or what, what questions you might have if you fall into one of these groups? So kind of a few key tenets for addressing issues like this across the board. I think the first issue that I want to raise is to remove the stigma. If you're entering into a conversation with somebody about this, don't be accusatory right off the bat. Don't assume to know why someone is vaccinating. Really be open and come into it with a curiosity, because I have been surprised in conversations with family members and patients what their concern was. And it was not at all what myself or others thought was the primary issue. I think being honest and not making stuff up. If you truly don't know the answer to a question, be honest about that. Tell someone that you don't know, and you can look it up together. I think one important aspect, and this goes to medical and scientific literacy in general, is when you can, and you see stories about vaccine safety, the pandemic, what have you, try to read beyond headlines. Headlines are helpful in hooking us all into reading something, but do not get at the subtleties of the story and are often there for recruiting readers, bringing in an audience. And so that's something that you can also encourage your peers to do, is to actually read the article and go beyond the sensationalized headline. As I mentioned, that hesitancy is not always true hesitancy, but sometimes inability to access care. So if it's within your capacity, offer to remove barriers. If someone needs a babysitter so they can go get a vaccine, offering to watch their kids, offering to give them a ride. Little things like that can make all the difference in letting someone get to the doctor when they need to. And know that it's not necessarily going to be an immediate change. So if you're trying to talk to someone about vaccine hesitancy, stick with it. Treat it, as within the relationship that you have with that person. Know that it's going to be an ongoing conversation, and that you may say something that will stick in their brain and they'll roll over for a few days to weeks and come back to it. But the number one thing I will say with all of this, and this is why you're here today in part, but refer them to their doctor. Study after study on vaccine hesitancy has said that the word of a trusted physician is the biggest, strongest tool in increasing vaccine uptake. And their recommendations are the most helpful. I think that caveat is that it needs to be someone that they trust and that they have a good relationship with. And it should be someone that has experience in pediatrics. So I wouldn't necessarily go to your, geriatrician, your parents' geriatrician and ask them about the pediatric COVID vaccine. But if there's a family medicine doctor or other provider in their community that you trust, that is worth its weight in gold. So as far as some specific ways to address vaccine hesitancy in the different subgroups, I kind of touched on this in a previous slide. But for the group that's unworried and that remains unvaccinated or not vaccinated with kids who don't think there's a risk, incentives and trade-offs are kind of the best way to get at that. Staying positive, really focusing on the altruism, the benefit to the community, and playing up that positive relationship. I would be proud of you if you did this, and staying away from sort of negative doom and gloom messaging is very helpful. For the skeptical group, I think, as I said before, listen, don't make assumptions. Ask them and ask critical questions about their concerns. Sometimes they may not even fully have a grasp on what their issue is. So get them to think about it and talk through it with you. The example I use for this is one of my relatives had concerns about vaccination for blood clots. But that is a very specific issue for one type of vaccine, the Johnson & Johnson vaccine, that is really no longer used, but not considered an issue with the mRNA vaccines by Pfizer and Moderna. But that was something that she had not been able to tease out from reading news stories, and had not had a chance to talk to a doctor about it yet because she had just moved and hadn't established a new relationship. So that made a huge difference. So kind of asking and talking to those things are great, and share your experience with these folks. We can have all the data in the world, but for most individuals, anecdotes, so stories from your life, or your kids' lives, or your husband, parents, close relative lives, do make a big impact. And then lastly, as I mentioned, I'm not likely going to talk about changing the minds of the ideologues. They're very challenging, but there is some room for peer pressure in this group. There was actually a really interesting article written in the Washington Post about the sort of effect of peer groups and those in our community making lots of decisions for people in this center. So if you are with a group and can slowly work on changing the tides within that group, that can be effective, but takes a lot more time and a lot more effort than sort of helping these other groups go through this. So my last slide is just a few resources where parents can go for trustworthy, reliable information about the safety of vaccines, efficacy of vaccines, and to answer some of the questions about side effects, about what's in a vaccine, all of those other sorts of things. So the American Academy of Pediatrics, or AAP.org, has great resources on this topic. Of course, the CDC has extensive amounts of information. And there's also a website called immunize.org that not just for COVID-19 vaccines, but for all vaccines, including the ones we get as children routinely, has lots of information about those, the components, the history, and what to do. So I think finding those trustworthy resources, as well as talking to a doctor, would be the other big area, are all good places to go for more information. So that is the end of my presentation, but I'm happy to take questions and chat with you all in a little bit.
Thank you. Okay. Our next speaker is Dr. Claire Bugard. Dr. Bugard is the medical director of the COVID vaccine program at Children's National and is a clinical pediatrician at the Children's National Children's Health Center at the ARC.
Yes, hi, good evening, everyone. Thanks for all of you who are joining today. I just want to give you a little insight into where we are in the pandemic, because I'm literally just came from clinic today. And a lot of people are asking, is it really still relevant, especially since this vaccine was created on the first variant of COVID, which was back over here. And then we had our Delta wave and the Omicron wave, and people are just confused. There's been a lot of information, a lot of infections. And this is the graph from the New York Times that talks about the rates of COVID-19 and where we are in the pandemic. And I pulled this off the website yesterday. So it's really up to date. This shows the different waves we've been through. And then this one was the one we just kind of weathered at the beginning of 2022. So the Omicron wave. And we're down to a lot lower levels than we've seen in a long time, which is good. One of the things, though, that I think is important to keep in mind is that we as physicians are happy to see things changing in this direction, and we're really happy to get relief. But at the same place, we're watching what's happening around the world. We tend to lag behind Europe, and Europe is starting to see another surge of cases. If you've been paying attention to the news, China is in lockdown for having a big wave of Omicron. And the next question we're all thinking as scientists is just with the spread of this disease, this novel coronavirus, is there going to be another variant that makes us go through this again, right? And makes either this vaccine more or less effective in the future. These are the rates in DC, and just for transparency, I pulled this last night off of coronavirus.dc.gov in their data section. So if anyone wants to double check or look this up, it's available data to the public. and has been updated regularly thanks to leadership in DC. And this just speaks to, again, what Dr. Jan said, which is the vaccination rates are not where we want to see them for the youngest group, for that 5 to 11-year-old group. And we're just here to see if we can address that in any way to make people feel more comfortable with it. And then the other thing, which is no surprise to us that, live and work in the district, but there is a disproportionate distribution of vaccine rates in the city, with the lowest being east of the river in Ward 7 and 8. The other thing is, if you've been paying attention to the news about this vaccine, the schedule for when to get the vaccine or when it's recommended keeps changing. So depending on your age group, this has changed with how many doses you should get and when you should get those additional doses. And given that this is a group really tailored toward school-aged children, we can start with this group here. The Pfizer vaccine is the only one available for the children 5 to 11. And right now there's just 2 doses. And this is back to the dose that was studied and how it is right now proven to be most effective. So we give 1 dose, and then about 3 weeks later, so 21 days later, you're due for your 2nd dose. There are no boosters for immunocompetent children. So if your child is not moderately severely immunocompromised, this is what your child would be getting. If your child is 12 and older, they have the opportunity to get the 1st dose, and then the 2nd dose can come now anywhere from 21 days to all the way out to 8 weeks. And that's just, they show that there might be some benefit for waiting a little bit longer to have a bigger immune system response. And with the Pfizer vaccine, there was, in particularly older adolescents, a small risk of something called myocarditis, which we're welcome to go into, but it is a self-resolving, in this case, myocarditis that doesn't require a lot of intervention, but has worried a lot of parents. And now there's flexibility to know that you can actually get that vaccine safely and in a recommended time, somewhere between 3 and 8 weeks. If you're over 12, they also now recommend a booster dose 5 months afterward. And we'll stop there just because the Pfizer vaccine is what we're traditionally doing for children. But this is right off the CDC website. And then if you're a parent of a moderately or severely immunocompromised child, the additional benefit is they can get a 3rd primary series 4 weeks after the 2nd dose, whether you are, whatever your age is now, 5 and older. For those with younger children, I just want to acknowledge, I also have a child who's 4. So if you're staring at this being like, there's nothing for the kids under 5, we hear you loud and clear, and we're hoping in the next month or so we hear more information. The other thing about DC locally is there's been a lot of policies that have changed. So part of this, topic today is just to fill you in on where we are at today. What I want to point out is that there are vaccine policies that are in the district that are relevant to your kids. So back in November, as you remember, any adult personnel that worked in a childcare facility, a public charter school, private or parochial, so essentially all the schools in the district, all adults were required to be vaccinated. And if you were a student athlete or from a group classified as being part of student athletics, so a cheerleader on the sidelines, you were also required to be vaccinated. Now, then there was this period of time during that large Omicron surge where actually 12 and older were even required to be vaccinated to enter certain private facilities or indoor facilities throughout the district that were not part of school. That has now expired as of the 14th of February. So just in case you're worried that that's still out there, that was expired. And again, the mayor's been really transparent about how these choices were made. Of course, individual businesses can still make their own choice, but the district as a whole has to make decisions based off the public health and the current public health guidelines. And they've been really cautious to be able to implement these guidelines and take them away as soon as they're able, and as soon as our hospital systems can really adapt to the environment that we're in at the time. The big one that's relevant to schools now is that DC has mandated that, again, all the schools in the district require a vaccine for anyone that's eligible to get a fully FDA approved vaccine. This is something that went into effect March 1st, but won't be really enforced until the next academic year. This goes along with the no shots, no school policy, which is also in place, which is relevant to all the other mandatory vaccines that DC requires to go to school. What I'd like to point out with this is you do need a fully FDA approved vaccine. And right now, the only group of people that that applies to is 16 and older, because that's what's been fully FDA approved for the Pfizer vaccine. However, these things are always under review and more data is coming in. So it's hard to predict which age groups will have a fully FDA approved vaccine by the fall. But my assumption is that there will be a few more age groups that are eligible by the fall. So just keep that in mind as you're heading into the next school year. And then access in the DMV. So really the best place to go is vaccines.gov. There's a great resource there that you can plug in your own address and find available slots throughout the district and the region if you bridge one of the Virginia or Maryland sides. There have been opportunities at schools and retail pharmacies. There's been pop-up locations, and then pediatricians throughout the community are offering this vaccine. I appreciate, Sherry, I believe you commented, like, why did children stop vaccinating kids? And what we want to say is we are vaccinating kids. We're vaccinating kids in our primary care locations and some of our specialty clinics. So if you're a diabetic patient in our endocrine clinic and you go up to the Sheikh Zayed campus, you can be offered it there as well, just as an example. And if you're admitted to the hospital, there's an option to get the vaccine. Resources are hard to find in healthcare in the middle of a pandemic. And during the last couple months, our hospital just had to use our staff and our supplies to really care for sick patients. And knowing that there was available vaccine available throughout the district in other locations, like at pharmacies and schools, we decided to close like our small volume centralized clinics. But really, we are still open to the people in these locations, and we certainly want you guys to feel like you have access. The only reason we really closed it off is because we knew that the community had the supports it needed to offer it to patients in different manners. All right. I think I'll stop there.
All right. Thank you so much, Dr. Bugard, for that information. Next, we'll move into the question and answer portion of this webinar. And again, feel free to place your questions in the Q&A box on the Zoom toolbar. So our first question that was submitted, is there any timeline for when the vaccine is expected to be approved for younger children? And were there any complications detected in children during the trials?
Well, maybe I can address that. The timeline is always up to the, what the results from the trial actually show. And you may have heard in various press releases and things that, for example, with Pfizer, there is sort of a continuous data sharing almost. As soon as Pfizer has information, they communicate with the FDA. I can tell you the studies are ongoing. We're in phases with boosters for all the kids, 6 months through 11 years of age, and collecting data. But it takes time. As I said, the visits themselves are not that quick. There are a lot of people involved. Again, it's all for safety issues. But also we have to wait time. So if we give a booster, we have to see what the response to the booster was. And so that requires blood sampling a month after the booster. So you can't really speed that up too easily. So I wish I could give you a hard deadline or timeline for this. I'm hopeful we'll hear some more in the next month or two, but it just depends on what the results show.
Sure. And Dr. Wiederman or Dr. Bugard, were there any major complications that were seen in any of the children in the COVID vaccine trials?
No, but that's a great question. And let me just say, some of these, we're we're monitoring for anything from very minor things like a sore arm, which of course does happen, to some of the more potentially serious things like a severe allergic reaction or the heart inflammation. These are pretty rare conditions. The way the trial is set up, and I mentioned there are centers now all over the world enrolling children. If there were a serious event like that, I would actually hear about it if it happened, you know, in South America or in Poland or who knows where. So the Pfizer is required to keep us all notified of any problems. So there haven't been any instances of that in the trial. It seems to be very safe, but remember, there are relatively small numbers of children in the research trials. So if we're talking about something, a very rare complication, that's usually only seen until after something is authorized or approved, and you know, hundreds of thousands of people receive the product. So those very rare things we have a good idea from in the teenagers and adults. Certainly don't expect, and nothing to indicate that it's going to be more common in the younger children, though.
I'll just add that as a
yeah.
parent, it's been really reassuring to see that, right? And even as a clinician, this isn't a hard vaccine for me to grasp risk versus benefit because of the high volume that we've seen of the actual spread of the virus in the community, mixed with the side effects, which really for the most part have just been the known reactions our body does when it builds that immune response. So of course, when you stick a needle in an arm, you can get a sore arm. But then after that, like maybe the muscle aches and pains feeling down for a little bit. I know I personally got like kind of chills and felt a fever, felt febrile, even though I wasn't for a day after my booster. That's all part of my body building the antibody response, which is what we want our bodies to do. And so I think it's a hard concept to understand that those things actually can be a good sign, because it does impact us, right? It made me going to work harder that day and things like that. But it's been really reassuring how safe it has proven to be in the initial studies and continues to be. Because remember, as a pediatrician, we very similarly, like outside of the trial, we are obligated to be reporting anything that pops up that we think is concerning about the vaccine. And so we know the CDC, from our experience with Johnson & Johnson, will act quickly if there's a common theme that pops up, like a clot or something like that. And so it's very reassuring that hasn't happened.
Absolutely. I like to tell families that when you have, that response of maybe like a low-grade fever or body aches after the vaccine, that's your body going to the gym, training to get ready for, maybe a future battle with COVID. So it's, like you said, it's a good thing, your body responding and recognizing that it would need to fight something like that. And a lot of people ask this question: if the vaccine for under 5 does become available, is it better to vaccinate a 4-year-old immediately or wait until they're 5 years old? And a lot of people had questions of if their child turns age in between the different doses. And Dr. Bugard, maybe you could comment on what you'd recommend in that situation if someone's like straddling age groups.
I'd say it's really hard right now to say what I would recommend for the kids younger than 5, because very similar to what Dr. Yant said, we don't want to share information that's untrue, especially if this is like recorded and like later, like the science doesn't fall where we want it to. So, but what I can speak to is the other age cutoffs. Dr. Wiederman said this in a meeting we were in once, and he was just like, nothing magic happens to your immune system between on your 12th birthday when you're 11 or 12. And what was interesting was the CDC originally said just do based off of age, and now the CDC says talk with the parent and see what they'd like, because really that small month or two difference between shot 1 and shot 2 If you're straddling it, so if you get one dose one time and your next dose would be at a different age, you actually as a parent can decide. So if you're someone that's really worried about side effects, you can get the smaller dose. If you're someone that really wants good protection, you can get the larger dose. For your question about, let's say, my son's birthday is in May, and so I could get it now. Should I wait? I am still, and I can have the others weigh in, I'm still, even with the lower rates now, it is best for your body to be protected sooner than later. I also am like a fierce child advocate. And for all of you who have watched your kids sacrifice over the last 2 years, their birthday parties, their social events, time in school, just regular routine, they had to wear a mask. Their freedom in some ways is dependent on getting this vaccine. There are some policies that actually give them freedom once they get it. And then of course, they might also feel some relief and anxiety once they get that, because they've been waiting for it, at least in my house. So I would say try to get the vaccine when it's available, because it's going to be helpful. All of them right now have been proven to be helpful against serious illness and hospitalization, even to the myriad of variants that we've seen so far, and they're all safe. So I would just implore you guys to give your kids the shot they've been waiting for, because it really has been, no pun intended actually, but it has really been a long couple years, and I really think they deserve to feel the freedom that a lot of us have had now for over a year.
Sure.
And I'm sorry,
Yes,
just to
please.
add to that, for the kids under 5, I wouldn't know what to say at this point, because we don't know any of the results of the trial. So I think when we have those results, things will be much clearer, and there will be specific recommendations. And then something that you can sort of think about, as Dr. Bugard said, with your child's and your family's individual situation, and make the best choice for your child.
Sure, absolutely. And one parent wrote in asking if the vaccine will affect the growth hormone in children. If anyone wants to comment on their thoughts on that question.
I don't know if you want to take that one, Dr. Yance, but just to give you a shot.
There is no reason to suspect that the vaccine will affect growth hormone in children. That being said, I don't know that there is a specific study being done on that, but they do developmental and early toxicity studies in animal models of these vaccines that did not show any risk or long-term complications for, in this case, rat or mouse babies, or maybe rabbits. So that's pretty much all I can say from that perspective, but I can also comment that in the history of vaccines, there has not been another vaccine that has impacted growth hormone in children.
Perfect. And then Dr. Wiederman, are there autistic children enrolled in the trials? Someone asked if there are any different side effects for someone that was autistic or had a mental illness with the vaccine.
So the trial itself did allow enrollment of children who had underlying illnesses. They needed to be stable. So even, for example, kids with HIV infection could be enrolled in the trial if it was well controlled. Having said that, though, there are relatively few children, once you start breaking it down, with specific underlying diseases or conditions like autism or autism spectrum disorder. So I think it's going to be hard to say anything about that from the trial. Again, no reason to suspect there would be any problem. And if you look at the situations where the vaccine has been authorized or approved, there are no signals to suggest that there's any problem in people with neurologic diseases of any type. And let me just say, some of the audience may not be aware that when these vaccines are authorized or approved, there's a very detailed kind of risk-benefit process that's gone through. So everything that is currently authorized or approved, it's very clear that it's worse to get the actual infection than it is to get the vaccine, no matter what side effect, So we talked about the rare event of the heart inflammation. That is nowhere near what the actual infection does to your heart. So the risk is much greater with the infection than if you've gotten the vaccine and hopefully prevented the infection.
Sure. And then Dr. Yance, a parent wrote in, why are parents scared or hesitant to get their child the shot, the COVID vaccine shot, if they're ages 5 to 11 and it's approved?
So, as I sort of mentioned in my talk, and I think that might have been the slide I skipped over, unfortunately, a lot of it is the uncertainty of the need. There's a lot out there about how mild COVID is in kids and how it doesn't really affect children. And thankfully, less children get seriously ill from COVID, but that's certainly not no children. And while some have chronic, underlying medical conditions, actually the recent MMWR published by the CDC, looking at the rates of hospitalization that exploded essentially with the Omicron wave, showed that most of those children did not have underlying medical issues. And that was, I think a third of the about 1,500 kids that have died, it has been in the last couple of months with the Omicron wave. So I think that's likely one of the major issues, that and the concerns about safety and the ongoing question mark, because new issues keep coming up.
Sure. And then someone also asked, is it a law that students that want to try out for sports need to be vaccinated? I think you touched on this, Dr. Bugard, but maybe just touch on it again.
It was a good question. Student athletes need it, but if you're trying out, I'm not sure. However, I can say if you're trying out, hopefully you get the team and then you would need it then. So I can't speak to if you need it in order to try out, but you certainly need it in order to practice and to play, because there is an increased risk of transmission the closer you are to individuals during certain sporting events.
So those were actually all of our submitted questions. I really want to thank the speakers tonight and all the participants that have watched this webinar. Again, it will be up on YouTube, so feel free to share that link with anyone that might have missed tonight that might be interested in the information we spoke about on the YouTube. Feel free to write in comments, asking questions. And if everyone that attended could please take a moment to, again, refill out that survey, asking about how you feel about the COVID vaccine as a parent. It takes about 2 minutes, and someone will be chosen that did the before and then did the after survey will be chosen to win a $50 Amazon gift card, and that will be emailed to them. So feel free to click this link, redcap.link.covid1234. I'll place it in the chat box again. Or you can use your phone and scan that QR code as well. And we might have just gotten a few extra
Yeah, I was about to say, Lauren, there's one question about long COVID. And since we have you and like Dr. Yance on the phone, I think that you guys are a great source of information for that if you want to touch on.
Yes, absolutely. So Dr. Yance, how about the long-term effects with COVID, with this vaccination and long COVID?
So how I'm reading this is, what are the long-term effects of this vaccination? So I'm hoping that I'm getting the question right, not necessarily in relation to long COVID, but we have as many years of data as we have the vaccine. Since the vaccines trials have been started, that's the amount of data that we have. Beyond that, again, I can say in the history of vaccinations, 99.9% of side effects that happen following vaccination occur within the first 8 weeks after vaccination. And through many, many years of study, which includes formal studies, includes information from the VAERS database, includes population studies, there really are no side effects, issues that pop up years down the road from vaccinations. And I think as Dr. Wiedemann really hit home in discussion about how the vaccine works, what these children are vaccinated with actually is degraded by the body nearly immediately, within hours, or if not days at the most. And so the immune response can continue, which is the goal. And there can be other effects. There can be triggers of autoimmune disease in susceptible individuals. And that's a different story, but even that has not been reported in large scale with vaccine studies. So I think it's definitely a question that people ask. And I want to emphasize that for studies of other vaccines that have been done, that you and I got as children, this is the same amount of data we had when those were approved and when those got started. So, over the years, we'll do more, things may come out, but you need to attack the problem that's in front of you. And like Dr. Wiedemann said, look at the risk benefit analysis, and the risk of getting the infection, even if it is unlikely to happen, is far greater than the risk of potential side effects that we have no reason to even imagine or suggest might be there. So it really kind of boils down to that decision point and what you need to do now to keep yourself healthy. But obviously it's something that continues to be collected. Everyone will continue to monitor this as time goes on.
Absolutely. Well, thank you so much for that. I think it's a normal human reaction, right, to be hesitant initially with something new. That COVID is new, the virus is new, and so it's normal to seek information, want to find answers. And like Dr. Bugard mentioned, speaking with your pediatrician is a wonderful resource, and Dr. Jans mentioned that as well. And feel free to email us any questions that we might have not gotten to today. And I again thank everyone for their time, and please take a moment to fill out that survey again to help us understand how parents feel about the COVID vaccine, and that would be wonderful. And again, thank you so much for everyone's time tonight. We really, really appreciate it.